and the Diwali celebrations. Really wish that you all had fantastic time with Diwali this time, and wishing you all a very, very happy Diwali and a happy New Year. So the New Year begins with a very well-known doctor that we are bringing on the panel this time, and very happy to have Dr. Akanksha with us on the panel. She is currently working at Manchester. And if I have to introduce her, she's working right now at St. Mary's Hospital in Manchester, a specialist in OBGY and reproductive medicine. And she worked as assistant professor in JJ Hospital as well. So she has multiple publications and presentations at national and international platforms in her name. Very prestigious degree of MRCOG and Royal College of OBGY in London. And when we speak about reproductive system, we speak about gynecology department. Majorly, this is where the life begins. And for each one of us, whether we speak about our journey as a soul, whether we speak about how we started on this earth, our journey, everything begins at the time of conception. Everything begins at the time a woman's body goes through a lot of hormonal changes. And everything begins at that time. What are the changes which are happening? So at a physical level, what happens during that time? What are the impacts on our body? That everything, we are very fortunate to have Dr. Akanksha on the platform to help. Hi, Akanksha. Very happy to have you here. A very, very warm welcome to you. And for all of you, she is not only a very, very good doctor, but again, even she has learned Theta healing as well. And she does understand mind-body connection very, very well. So very fortunate to have you here on this platform, Akanksha. A very warm welcome to you from the platform of Cesta Healing Studio.
Oh, thank you so much, Sangeeta. Thanks for the kind introduction. And I'm really glad to be here myself. And as you mentioned about me, that I have a strong feelings about being a holistic kind of treatment that I should be giving to my patients. And that's why I came and learned Theta from you, which I really enjoyed. And yeah, I'm really glad to be here to be able to help anybody with any queries that they have for me.
No, definitely. I will, in fact, a lot of things what we understand from the spiritual perspective. You are the one who really, from the medical perspective, gave us a lot of clarity when you came that, when we speak about baby in the womb, when we speak about that, every soul, like majority, 90% begins their journey as twins and then it remains one. And even today, I remember that you were the one who confirmed it, because I was not ready to believe what was given in the book. And I was like, no, how can that be? Like, that's not possible. But, when I was reading Vayana saying that that's why the soul begins that absolute sense of loneliness from the beginning, and why the baby in the womb is so important. But when you came in the class and I was teaching, and here in my mind I was thinking, oh, she's a doctor and she understands it. What if she challenges this and she tells me
but I confirmed it.
what rubbish are you talking? It doesn't. But I was like, no, but my job is what my teacher has taught me and how it happens, to speak about that. And when you confirm that, this is how it happens, I was quite shocked. And I guess you presented even for the birthing your paper in one of the conferences here. Yeah. So great to hear for you to be here with us. And I think rather than me taking more time on this platform, I would like to hand over the entire platform to Dr. Akanksha, because everybody has joined to listen to you. And today, like, not to listen to me. And so friends, unlike every time that, we have the entire session, and then on Friday, we have the Q&A. because Dr. Akanksha is not available on Friday. So she will explain you the effect of hormones on the body and all today. Like we have already given you the guidelines on what are going to be the topics for the next 4 days. But last 10 minutes, if anybody has a question, they can raise their hand and, she will be very, very, very happy to answer you from the medical perspective. So, Dr. Akanksha, the platform is all yours. We are
Perfect.
here.
Thank you. Thank you, Sangeeta. So, yeah, so I don't know how many of us are women attending here, and I'm glad if there are any males, because I think they need to understand this more. Because as women, we know what's happening, but there's a lot of times there are partners, children, or even colleagues. They are like, oh, why is she behaving odd? Because it's that time of the month, and we hear it all the time. And it's really important that we understand that it's something physiological, it happens, and how we can deal with it better. Because we all go through it, and we just have to find our own mechanisms to deal with it, if you like. So I'll divide my brief talk today into physiological and pathological kind of areas. So physiological, I'll speak Hindi in between just to make it simpler. So physiological is just बिना बीमारी के, तो जो हर महीने हो रहा है. So every month we all get periods. It's something everybody goes through. But along with the periods, which is a physical body change, there is a lot happening in the background. So the hormone levels, they follow a very cyclical rhythm, and it works like clockwork for some women. For some women, it is like, if you ask them, if I see them for consultations, they'll be like, oh, my cycles are clockwork, every 28 days, every 30 days. For them, it's very easy for us to predict how the hormones are changing. But some women, they would be like, oh, my cycles are all over the place. I have a 20-day period, sometimes I have a 40-day period, and I just don't know when I'm going to come on. And these are both normal, I would say, but it's just how the body reacts to it. So at the start of the cycle, the hormone levels go really down. So physically, you feel a bit more lighter. Emotionally as well, you are more happier, if you like. And mentally also, you are more alert. So these hormones can affect you in your physical body, in your emotional self, in your mental self as well. As the cycle goes along, there are two different hormones which go in the body. One is called estrogen, and the other one is progesterone. So the estrogen levels start to go up, which give, it's a beautifying hormone, if you like. So you feel your skin is better, you feel your hair is looking nicer in those days, and you're feeling generally well in yourself. Your libido is high, your sex drive is high at that time, and that is the time the body is going to release an egg, and that's just a not natural mechanism the body has, so that it will attract a mate to have a pregnancy at that time. Once that phase is gone, and then the other hormone starts rising, which is called the progesterone, which is the pregnancy hormone, or which will help the womb implant the potential pregnancy. And this happens every month. So every month the body prepares for a potential pregnancy. And when that hormone comes, and we know what it does to each one of us. So it makes us feel bloated, heavy, dull. Maybe acne start coming up around that time. Maybe the hair is not looking that good. And you just feel a bit low. And there is a medical terminology that we use, which we call as premenstrual syndrome, or premenstrual dysphoric disorder. Which means basically just before your periods for a week or 10 days, women feel really, really low. The women who actually suffer from depression, they feel that they have an exacerbation of their episode of depression. Or if somebody who's not even, depressive or has any medical kind of problems with their mental health, even they feel a bit low. And this can range from just feeling a bit low to the other spectrum, where actually women start to even feel suicidal. And it is very, very significant. And somehow it's more in women who are not very active, or somehow it's more in women who are not working, or are homemakers, probably because their mind is not occupied, they are thinking more about it. That's what the literature says. But we know that we all suffer to some degree with it. There are various therapies, or medical therapies available for this. something we even give antidepressants to treat this, and the other treatment would be to give some hormonal pills, which some women like and some don't. So basically, if you give the hormonal pills, you're just shutting the body's hormones completely, and that's how you're stopping it. Antidepressants will help to some extent to some women, but the mainstay of treatment here is actually lifestyle modification. And if we address the literature, actually 80% of these cases can be treated by just lifestyle modification. And what I mean by lifestyle modification is activity, at least 30 minutes of any form of exercise, at least 3 times a week, healthy eating, less saturated fats, a lot of greens in your diet, and meditation. And it is actually one of the mainstay of treatments for this condition. I should not even call it a bimari. It's not a pathology. It's something that happens to everybody. And it just kind of tells us the importance of how important it is to keep your mind body balance, and how important it is how you can take charge of these hormones, not let them overpower you. And I'm happy to answer any questions that come up on this, because I can go on about these treatments, but then I'll see how much people want to ask. And if I come to the other spectrum where there's actual pathology, jab asli mein bimari hai, and when there is bimari, that means that there is some problem which probably needs more of a medical treatment. There are various things that can affect, like thyroid hormone ka problem hai, prolactin hormone ka problem hai. Otherwise, there are there are women who don't release an egg every month, and there are women who have polycystic ovaries. A lot of us have heard that. It's very, very common in Indian population. About 1 in 4 of women who are 25 to 35 years of age will suffer from polycystic ovaries. So it's that very common. And they don't ovulate every month, and which can cause their periods to prolong, and which can even exacerbate they can actually put these hormones into imbalance, and which can obviously need more form of medical therapy, if you like, and that will be very cause specific. So I can't go into the very details of each one of these because they will need a bit more of medical therapy, I should say. And obviously, in the subsequent days, in the next 2-3 days, I will talk about how these hormones change when, specifically when women who are trying to conceive, there can be some problems, and how it affects the pregnancy and menopause. But today I'm going to just limit myself to, mainly I wanted to emphasize on the premenstrual syndrome and how it can affect everybody. And it's that time of the month when we need that extra support, I guess, from our partners, and a bit of more self-care for ourselves as well. Can't hear you.
Sorry. So before everybody else will ask a question, like I have a question, like I'm a little curious about it. So the different schools of spirituality have a very different notion about women being in the menstrual cycle. So religious perspective, like, I mean, we all know that many of the Indian temples, they say you cannot enter the temple, you are impure, and a lot of things which the current generation always argues, and they are like, how can that be impure or something? So we are not touching that aspect of it. But spiritually, like, I mean, since I studied in two very strong different school of thoughts. So one always taught us that women at that point of time, from the perspective of their auric space, is very vulnerable. And that's why, like, they require to be very careful, because their aura can have a rip. But at the same time, the other school of thought actually taught us that women at that point of time in their menstrual cycle is very strong. And in fact, they are like, much more stronger than the regular days. But from the medical perspective, like, I mean, what does the medical science speak about it? During the menstrual cycle, is the women like more stronger than the regular days, or is she a little weaker on the?
So there are two aspects to it. So I would say, if you're talking about immunological system, that is our strength to fight infection, that actually goes down at that point.
Okay.
So so if you say bimari se ladne ki shakti, that is actually low. So we will see women catch more cough and cold around that time, and it is quite common if you were in another part of your cycle, if you were in touch with somebody who had cough, you might not catch it. But if you are during your periods, you have more susceptibility, and that's because of the way immune response of the body actually goes down at that point. So I don't know how it syncs with your spiritual teaching, but if immunologically they go down. And hormone wise, I would say all the hormone levels are really, really plummeted down. So I would say, mentally or emotionally, they would be a bit more in a stable position because they've just finished their premenstrual, that hormonal surge, and they have now come into a better place where they are more with themselves. But immunologically, if we see strength to fight infections, that actually goes down at that point.
Okay. Thank you. So, friends, if you guys have any question, you please ask. Because if you don't have, then I will keep on asking. But if you have, like, she's here to answer all your queries. So please, anybody has any questions connected to hormonal imbalance, connected to like any hormonal imbalance during the menstrual cycle, anything else, please raise your hand so we can unmute you and you can ask Dr. Akanksha your question or your query. Is there anyone who has any query or any question?
And I appreciate that some of the queries might be a bit personal. So if you put them on WhatsApp, I'm happy to address them later, because it's a bit difficult to come up with these queries on a forum, I guess.
No, but like without like it sounding personal, people can still ask as a general
of course, definitely.
about those queries. So I do not see right now anybody because asking a question. So either probably you explained it very, very well, or I'm assuming that nobody has ever got any problem with the menstrual cycle or hormonal imbalance. So people don't have any question to ask, or they really understand the topic quite well. So that's why probably they are not asking any questions connected to that. So if nobody has any questions, Akanksha, like I have another question that we always heard that probably in olden times, the women never felt the impact of it so much, or I've never heard them like, that, oh, I have severe pain and all. So is that the current pollution level or the food style which has changed, or the lifestyle which has changed, which has made women more vulnerable to that? And, we see a lot of young girls also complaining that, having severe menstrual cramps or anything. So is there any guideline which they can follow to avoid that and can help them with the same?
So like I said, like lifestyle modifications go a long way in controlling this. So like I mentioned earlier as well, that homemakers were at currently the homemakers, or somebody who's not very actively involved, somebody who has a bit more free time, they suffer more from premenstrual syndrome. So they suffer more from that emotional baggage, if you like. But dysmenorrhea is very, very common. We see it a lot in especially teenage and early 20s. There are a lot of women who are suffering with that. And we can't pinpoint why it has gone up. I think one is the awareness of self has gone up. Earlier, I think women would suffer in silence. And now if anybody is suffering, they come up with it. It also has to do with how we perceive our body. We want to be comfortable all the time. And so I feel that you would still see that some women from lower strata, they would not complain of it ever. Because their pain thresholds is high, or they feel that's the way we are supposed to feel. But somebody who's a bit more educated, into work, and obviously it affects with their work schedules, and they want to keep themselves very comfortable, and they would kind of complain more about it, or perceive it more. And it also goes on how we uh, uh, how sensitive we are about our body. So some women would even come and tell me that, oh, I ovulated from the right side this month. So I'm like, how do you know? Because I know. So something just tells them. So and you can't argue with them. I mean, because they know their body. And some women would say, no, I don't feel anything. So I think it's also the personal sense of how much I perceive my body, how sensitive I am to it.
Is there any particular suggestions or any guideline that you would like to give to the girls, I mean, at the time of the puberty, and then they are going to start menstruating? So, like, as parents, like what, I mean, the parents should be taken care
So
of, or
one thing
for the
which I
girls
probably
also.
should have included in the earlier discussion was basically the age of menarche. That's the age when you start menstruating has actually fallen down. So 50 years before, girls would be around 13, 14, or even 15 when they would start menstruating. But nowadays, it's very common for girls who are aged 9, 10, or 11, the average age has shifted from 14 to 11 in literature. So why has this shift happened? And that shift has to do with the total body fat ratio. So when the total body fat to the body mass ratio actually hits a critical level of 22%, and that's when the body will start menstruating. It's just a signal that goes to the brain that, oh, now the body is ready to menstruate. And that has to do with the obesity levels. So I would say that somehow it's very important to introduce physical activity at an early age in life. And this doesn't have to be, I would say it has to something come like more population based rather than an individual thing, because it's a population thing which has shifted it from the age of 14 to age of 11. And we don't, like as doctors, we always try to educate the patients and young girls to keep their weight under control, because it's really important to balance their hormones right.
Your,
So
your voice is little bit had started breaking. So if you
sorry,
can, yeah.
is it okay now?
Yeah, it is better, much better.
You want me to repeat what I said?
Uh, I guess so, yeah, because it was echoing.
Okay, so I was just saying that the average age of menarche, that's the age when the girls start menstruating, has shifted from 14 to 11 over the last 50 years or so. And we can sense it, like the age we started menstruating is not the same as the generation today. They start menstruating early, and it has to do with the total body fat ratio. So once it hits a critical level of about 22 to 25%, that's when the body will start menstruating, irrespective of the age. So a very important message is to keep the physical activity up and to keep control the obesity levels in these young girls, not even teenagers, even pre-teenagers, school kids, for them to have a healthy start to this reproductive cycle.
Okay, thank you. I think somebody had a question. Meg, can you please read that? On the chat, somebody had put something. So,
Yes, ma'am. Ma'am, the question is, after delivery, every time few days before period, I can't move my hips sideways while sleeping at night. Is it because of lifestyle?
do you want her to repeat that, Akanksha?
No, I can read that on the chat. So you're talking about a vaginal delivery, is that right? Is that what the question is? Yeah.
I think the question was about not being able to
Yeah.
move.
Yes. Yeah. So that is I think I'll touch upon this in the effects of pregnancy, because I'll talk about the changes in pregnancy. I'll briefly say that it can be because of lifestyle and also the hormones of pregnancy, but I'll talk more detail about it on the day when we talk about pregnancy changes, if that's all right.
Okay. So the day she will speak about the pregnancy, that time she will cover up this topic completely. And anybody else has anything to ask regarding the menstrual cycle, the premenstrual cycle thing also? Why is this device showing? One sec. So, yeah, the premenstrual cycle, any hormonal imbalance or post that. Anybody has any questions regarding that? So please, you can ask Dr. Akanksha your questions about that. No, I do not think. Is there anything which people should ideally taking more care to not to have those mood swings and to let, I mean, the flow be normal, let that entire phase go very normal, which is something, like sometimes people are aware from the beginning they are doing. So one is like you definitely mentioned about the obesity that they require to take care of so that it doesn't happen, right?
Mm.
And is there anything else like the lifestyle changes you spoke about, adding more greens into their food and diet and all, start a physical activity much before
Mm.
and not at that time? So these are the things, but anything
And I would say keep maintaining the mind body balance. So there are two aspects of it. So physical aspect is to keep the activity levels up, and even from the start, and obviously control of weight. So losing weight helps, but even if you're not losing weight, if you're physically active, that helps a lot. So losing weight is a different, I would say, ball game, because you are trying to cut your carbs and this and that. But physical activity in itself, even without attempting weight loss, is really important. So trying to, take the stairs instead of lift, little changes. If the bus or the rickshaw is dropping you 2 blocks away, try to take that 10-minute walk every day. So doing a proper exercise is obviously nice, but making these little changes which can keep you physically active are really important. And the other aspect would be to keep your body balanced, and trying to, like, giving yourself 10 minutes of self talk, or like a meditative space where you are just with yourself, just trying to achieve like serenity within yourself. That's really important as well to control those mood swings.
Okay. So thank you so much, Akanksha. And I would like to end this session with just saying that we as women or any gender that we are born with, when we accept ourselves and when we are very proud of our femininity, majority time, that is what where the flow and everything goes very smoothly. So, in our understanding, from the perspective of theta healing, we realize that majority people who came with any sort of gynecological problem, majority time the problem begin with their inability to be able to accept their own femininity or their own gender, or feeling that why am I being born as a woman, or a sense of insecurity that it comes along with it, and any of the past trauma or abuses, or feeling women as a weaker gender, that influences the menstrual cycle also a lot. So the last day we will speak much more, but to before we end the session, I would really like to do the just one or two downloads on the same for everyone. And friends, just these talks are not just for the women, it is for the men also, because every house has a mother, every house has a sister, daughter, wife, your sister-in-law. And when you understand it, then probably, you understand what they are going through. And it's very important that men understand it and they attend the sessions. And they also ask the questions. It is not for the women to understand for themselves. So please request your partners and all also to attend. At least, they develop a better clarity about it. And let us just do one or two downloads for the same. So with everybody's permission. So would you like to know what it feels like to accept yourself in totality for who you are, what you are, and how you are? Would you like to know the how to have the balance of your yin and yang energy through creator's definition and perspective of the seventh plane of creator of all that is? Would you like to know what it feels like to accept your femininity and the masculine principle in the body through creator's definition and perspective of the seventh plane of creator of all that is, and to let, along with the higher self, decide the right balance of both, and that it is possible, deserving, and it is safe for you to have the right balance. Would you like to know what it feels like to move on beyond? Any stories of the trauma that you may have heard, or your own past memories that might have been stored in your womb, that be cleared and cleansed, and allow yourself to be in the rhythm of the body and allowing your body to be in the rhythm of the universe? Would you like to know what it feels like to allow the body to sing and body to dance, and to understand that life is a celebration, and you allow yourself to connect to this life pause and to live every day of your life as a celebration? You know how to do that from the Creator's definition and perspective of the seventh plane of Creator of all that is. You know that it is safe for you, it is possible, and you're deserving to live every day of life with joy. You know how to live your everyday life with joy and to tell yourself, I am joy and I represent joy. My body is a temple and I worship my body and I am in sync with my body. Into every cell of your body, every area of your life, at all the four level of your beliefs, for your highest and best in the highest and best possible way for you. So, Creator of all that is, it is commanded to instill these feelings into everyone who says yes right now and later while watching the video, into the language their mind understand and into the language their mind perceives the best for each one's highest and best, for the highest and best possible way for them. Creator of all that is, it is commanded that any sort of imbalances that anyone may have invited or attracted by the limiting belief patterns, they allow themselves to clear and cleanse the trauma and the abuses from the cycles, and allowing them to surrender it to the Creator's light to be transformed into the energy of unconditional love light. And to know that what your body can create, it can discreate and recreate a new reality. And each one allowed themselves to have the perfectly healthy body, and that it is completely possible. Into every cell, fiber, tissue, molecule of your body, every area of your life, at all the four level of your beliefs, for each one's highest and best in the highest and best possible way. Thank you, it is done, it is done, it is done. Creator, show me. For whoever says yes now and later at the level of their readiness to bring the change. Thank you. Passing unconditional love, light, and healing to each one present here. Thank you. So, Dr. Akanksha, thank you so much for joining.
Thank
Friends,
you.
request each one any gynecology related, any problems that you have, please put it on the WhatsApp group, send it to the office, put it on the YouTube, on the Facebook, so that we can help you answer your queries. Dr. Akanksha can help you answer those queries. We already have given you the schedule of every day. We'll be taking one topic. I would request if there are people who really want to understand from Hindi, that is also completely possible. So do send your feedback to us so we are at a better place to be there to guide you on this subject. So thank you so much everyone for joining. This entire week we are taking it at 9:30 p.m. minimum till Thursday. So see you all tomorrow 9:30 p.m. along with Dr. Akanksha. Akanksha, thank you so much with lots of
Thank you,
positive.
Sangeeta. Thank you so much.
Thank you. Thank you so much. See you all tomorrow.
Tomorrow. Thank you.